When you're young, going to the bathroom is simple. The bladder fills, the signal comes, and urine flows easily. But as men age, something begins to change. The prostate gland, which quietly sits below the bladder, often starts to grow. For many men over 50 or 60, this once silent gland can become a constant source of frustration. Suddenly, urination isn't as smooth. The flow is weak, incomplete, or interrupted, and the nightly trips to the bathroom become more and more frequent. But here's the important question. When the prostate grows too large, what options are available to help? And more importantly, which treatments actually work in the long run? And which ones come with challenges that no one tells you about? Today we're going to break it all down. The traditional treatments for an enlarged prostate, their pros and cons, and a newer modern option that many men haven't heard of yet. By the end of this video, you'll have a clear picture of how doctors approach prostate enlargement, and what you might want to discuss with your own physician. Let's start with the basics. The prostate is a walnut-sized gland that surrounds the urethra, the tube that carries urine out of the body. When the prostate is small and healthy, urine flows right through without obstruction. But as the years go by, this gland often increases in size, sometimes doubling, tripling, or even more. That growth squeezes the urethra like a clamp, making it harder for urine to pass. This condition is called benign prostatic hyperplasia, or BPH. It's not cancer, but it can feel just as disruptive to everyday life. So, what do clinics usually offer? One of the older methods is something called a stapling procedure. Doctors insert instruments through the urethra to reach the prostate. Tiny staples are placed to pull back the enlarged tissue, opening up the blocked passage, so urine can flow again. At first, this sounds effective, and for many men, it does bring relief. But there are drawbacks. Over time, the prostate can grow back, pushing against the urethra once again. And in some cases, those staples may break down. It's not always a permanent solution. Another option is laser treatment, often referred to as green light laser therapy. This is a procedure where a special laser vaporizes excess prostate tissue that's pressing on the bladder outlet. It's performed under anesthesia with a telescope inserted into the urethra, guiding the laser to the exact spot. The tissue is burned away, and for a while, the passage opens. But again, this method has its own limitations. The prostate can regrow, scar tissue can form, and some men experience discomfort or lingering side effects from the burns left behind. Now, you may be wondering, what happens after procedures like these? Well, here's a part most men don't hear about until they go through it. After surgery, the body needs time to heal. The urethra becomes inflamed, and urination on your own may not be possible right away. That's why a catheter, a tube inserted into the penis, is often required for days or even weeks. It helps drain urine until swelling goes down. Understandably, this is uncomfortable for many men, and it can be discouraging to think that the road to recovery might involve extra hurdles. Before we move forward, let me ask you, have you or someone you know ever experienced these procedures? What was the recovery like? Share your thoughts in the comments below. Your story might help another man feel less alone. And while you're here, don't forget to subscribe to The Healthy Body. We bring you new insights every week on men's health, intimacy, and aging well. And subscribing ensures you won't miss important updates. Now let's talk about something different, a modern and less invasive method that's gaining attention. Prostate artery embolization. Unlike the other treatments we've discussed, this approach doesn't involve cutting into the urethra or burning tissue with a laser. Instead, it targets the root of the problem, the blood supply feeding the prostate. Here's how it works. Through a very small incision, usually in the groin or wrist, a thin catheter is inserted into the arteries. With the help of imaging technology, the doctor carefully guides this catheter to the vessels that supply blood to the prostate. Once in place, tiny beads are released to block those arteries. Without constant blood flow, the prostate tissue begins to shrink. Over time, it returns to a more normal size, relieving pressure on the urethra and allowing urine to flow freely again. The beauty of this method is that it doesn't require cutting or stapling the prostate itself. There's usually no need for a catheter afterward. Recovery tends to be quicker, and many men experience long-term relief without the same risk of regrowth that comes with traditional procedures. Of course, like all medical treatments, it's not for everyone, but for many men, it's a safe and effective option worth exploring. Let's recap for a moment. An enlarged prostate can make daily life frustrating, from weak urine flow to constant nighttime bathroom trips. Traditional options like stapling and laser therapy can help, but they also carry drawbacks such as regrowth, discomfort, and temporary catheter use. Prostate artery embolization takes a different route by reducing blood flow to the gland, allowing it to shrink naturally and making urination easier. It represents a shift toward less invasive, more comfortable care. So if you or someone you love is dealing with BPH, remember this. You don't have to simply accept it as part of aging. Treatments are available, and newer options may offer better outcomes with fewer side effects. Always discuss these with a qualified urologist or interventional radiologist to see what's best for your situation. Before we wrap up, I'd love to hear from you. If you were faced with these options, would you choose a surgical approach, or would you prefer a less invasive method like artery embolization? Drop your answer in the comments below, and let's start a helpful conversation. And finally, thank you for joining us today. I'm Dr. Alex, and this is The Healthy Body, your trusted source for insights on sexual health, intimacy, and aging gracefully. Don't forget to subscribe if you haven't already. It helps us grow and allows us to keep bringing you more valuable content. Until next time, take care of your health and your body. It's the best investment you'll ever make.